Okay. Hi, everybody. I'm Loretta Byrne, and I'm the National Project Manager for ResearchMatch. Welcome to today's webcast, an overview of NORD and how it may be helpful to you, which is offered in collaboration with our featured partner and speakers from NORD, the National Organization for Rare Disorders. On this webinar, you'll hear about how to access information and resources about rare disorders, health insurance, treatment and care, many programs designed to help patients, and how NORD advocates for patients and the advancement of research. The information and statements expressed on this webinar are not intended to be a substitute for professional medical advice, and you should seek your own professional counsel before altering any care plans or in effect to your medical condition. So just a note about us, ResearchMatch is funded by the National Institutes of Health, and since 2009, we've been connecting people who are interested in learning and participating in research with researchers. Thousands of people take part in research through ResearchMatch, and it's free to everyone. ResearchMatch, which was created by Vanderbilt University Medical Center, is a large collaboration project, and it connects you with 199 leading research institutions in the country and nonprofit organizations like NORD. So let's meet our speakers. Alicia Lawrence is not with us today, but she serves as the Patient Services Case Manager at NORD. Jill Pollender is the Vice President of Patient Services at the National Organization for Rare Disorders, and as a member of NORD's leadership team, she oversees NORD's Patient Services Department, including patient assistance programs, information, and resources. Marcia Lanes is a board-certified genetic counselor and serves as medical editor at NORD. As a member of NORD's Educational Initiatives Department, she develops educational resources and programs related to rare disorders for patients, caregivers, medical professionals, and students. Eliza Fink. Dr. Fink joined NORD in 2021 as the Director of Research Programs. Eliza oversees NORD's research and scientific activities to provide the rare disease community with innovative tools and evidence to engage in impactful research and foster medical advances. Corinne Alberts is the Associate Director of Policy with NORD, where she focuses on legislative and regulatory issues impacting the 25 to 30 million Americans living with a rare disorder. Thank you, ladies, for joining us. We're so glad you're here. And with that, I will hand it over to Jill Pollender, who will be covering Alicia Lawrence's section, who unfortunately could not join us today.
Hello, thank you so much for the introduction, and thank you for the invitation to join you all today. As you heard, I'm Jill Pollender. I am the Vice President of Patient Services at NORD. I'm a nurse by trade and training, and I really do have the pleasure and privilege of overseeing patient services. Patient services is made up of patient assistance, information and resource services, and clinical trial, travel, and lodging support. Next slide, please. Thank you. NORD is a 501c3 organization. We're a patient advocacy organization dedicated to individuals with rare diseases and the organizations that serve them. NORD, along with its 330 patient organization members, is committed to the identification, treatment, and cure of rare disorders through programs of education, advocacy, research, and patient services. At NORD, we really believe that all people living with a rare disease have a fundamental right to their best health and well-being. And with that belief as our guide, we really strive to advocate for solutions and address the complex and nuanced needs of the rare disease community. So a little bit about patient services. Patient services, we're going to go back one slide, sorry about that. Patient services is a dedicated team that mans really a multi-channel communications center. So we put phone, fax, and email all together in one place so that individuals and their caregivers and those that care for them can reach NORD representatives in a single source to get care, treatment, guidance, and really seamless access to those things that are most important to the rare disease community. To give you some idea about the Patient Services Department and the breadth of the individuals we assist. Last year, 2021, we assisted 9,951 individuals. And when I say we assisted individuals, a large part of that is financial assistance. Just shy of $40 million in financial assistance was provided last year through our patient assistance programs. And that patient assistance may take the form of assistance with health insurance premiums, access to care, access to medications, access to ancillary and supportive services. The patient services department answers about 69,000 calls a year and responds to 65,000 plus emails a year. So it's a really busy department, and it's a really important gateway, if you will, to information and resources for the rare disease community. Next slide, please. When we look at patient assistance and patient services, we look at what are the nuanced needs of the rare disease community. How can we best help individuals to live their best rare lives? Sometimes that's through financial resources and funding. Sometimes it's through other resources, information, helping to navigate health insurance. What do you do when you get a denial? How do you pick the right health insurance carrier? How do you access a center of excellence? How do you find a specialist? All of these are questions that are posed to the patient services team. And a large part of the information and resource services team is spent looking for those resources, identifying those resources so we can share those with the rare disease community. When we look at care and we look at the needs, we look beyond just health and well-being. We really try to take a 360-degree view of the community. And so it's not just individuals who have internet access, or it's not just individuals who live in suburban or even urban areas, or that have internet access and have robust resources. We really do try to take that nuanced look. And I will say in 2021, we provided assistance across 50 states and 3 US territories. Next slide. The assistance we provide can take a number of different forms. And for those of you who aren't familiar with patient assistance programs, traditionally they look like programs that can help with the financial aspects, out-of-pocket costs for health insurance premiums and copay costs. But NORD goes beyond that. So not only can we assist in some of our programs with health insurance premiums and the copay cost to see your doctor, fill a prescription, pay for physical or occupational therapy, infusion costs, but we look at costs that individuals experience outside of that. So for example, travel and lodging. We know with a rare disease and a rare diagnosis, you can't always see the physician that's local to you or right on the corner or accessible by the nearest bus. You may need to travel to see that specialist. And so some of our programs provide assistance with travel and lodging assistance. We look at expanded access. We look at free drug programs. We are, as a 501c3 charity program, dependent on donors for the funding that we provide. And we look beyond just those traditional programs to innovative and responsive programs, things like our Rare Caregiver Respite Program, our Rare Disease Educational Support Program, and the Medical Alert Assistance Programs. You can go right on our website, rarediseases.org, and you can find all of the programs and their current statuses right there at your fingertips. If you don't have access to the internet, you can reach us. We have that dedicated communication center that I mentioned earlier, and that is staffed from 8:30 a.m. to 7:00 p.m. Eastern Time, Monday through Thursday, and 8:30 a.m. to 6:00 p.m. on Fridays. Next slide, please. So we talked already about the fact that we get a large number of calls and a large number of emails. What are patients looking for? What are the caregivers looking for? Sometimes it's, where do I start? I was just diagnosed. What do I do? What's the first step? Or I've been prescribed this medication and I can't afford it. I just don't know what to do. I need a first step. I need some guidance. I need information about this diagnosis. Nobody's ever heard of it. And so the rare disease reports are housed on NORD's website, rarediseases.org, and that's a great first stop for looking for information. And in those rare disease reports, you can also find support and advocacy groups. You can find information about investigational therapies, and it really is a great first step. Other inquiries that we receive have to do with navigating that insurance, challenge, if you will. What do you do when the insurance company denies you, or you need to get prior authorization, or you need to change insurance? How do you find the right insurance for you? So as I said, a lot of times it is following the trail, finding the best path and the best course forward for you. Next slide, please. Thank you. So we look forward to assisting you, helping you as you navigate living rare, whether that is to find resources, whether that is to answer questions, whether it is you're undiagnosed, you're newly diagnosed, what kind of guidance can we provide and what kind of resources and support are out there? We'll look forward to helping you. Thanks very much.
Thank you, Jill. Next, I'd like to introduce Marcia Lanes.
Thank you, Loretta. And thanks, ResearchMatch, for inviting me to talk to you all today about NORD's educational programs. Next slide. The Educational Initiatives Department at NORD is a powerhouse team of 4 full-time and 2 part-time staff, and we work together to develop educational programs about rare diseases for a broad audience. Providing educational resources for patients and families has been an important part of our mission since NORD was founded almost 40 years ago, and this continues to be our primary focus. We also have programs targeted to physicians and other healthcare professionals, as well as students preparing for healthcare careers. And for the next few minutes, I'll talk a little bit about the resources and programs that we work on. Next slide. NORD's Rare Disease Database, as Jill mentioned, is a compilation of reports on specific rare diseases written in patient-friendly language. The intended audience is newly diagnosed patients and family members, but we know that the database is also accessed by healthcare providers, students, school teachers and school nurses, journalists, and the general public. Each month, there are almost 2 million visits to the NORD website, and about 84% of these visits are from people seeking rare disease information. NORD reports are written in a standard format and include a general overview of the condition, signs and symptoms, causes, diagnosis, and affected population, as well as standard therapies and investigational therapies. Reports also include contact information for disease-specific patient organizations that can provide more information about the condition, many of which are NORD member organizations. We have over 1,300 reports in the database currently, and we work with our members and rare disease medical experts to update the reports and add new topics. Some of the reports in the database, like this one on Friedreich's ataxia, include an embedded animated video about the condition. We're working to add more video resources because we recognize that people have different learning styles and preferences. If we don't currently have a report on a particular rare disease, a search of the rare disease database will provide links to information available from the NIH Genetic and Rare Diseases Information Center, or GARD. Next slide. NORD's Rare Disease Video Library houses educational videos for a broad audience, including patients, caregivers, students, and medical professionals. We collaborate with our partner Osmosis to develop these animated videos, which are made possible by individual donations, educational grants, and corporate sponsorship. Whatever the funding source, NORD is solely responsible for the content of the videos, and the content is vetted by a rare disease medical expert. Some of the topics are of broad interest to the rare disease community on topics such as gene therapy or genome editing. And many of the videos are on specific rare diseases, like this one featured here on thyroid eye disease. We've also developed videos in collaboration with NORD's research department on the topic of patient-focused drug development. And we're working on new videos on the drug development process and data literacy. These videos are designed to help patients and leaders of patient organizations learn about research and development and how they can get involved. Next slide. The education team has developed a webinar series with live interactive presentations that cover topics important to patients, families, and caregivers. We typically have about 600 registrants for each webinar, and viewers can attend live or watch the recording on demand at a later date. We partner with NORD member organizations and government agencies to develop content and identify speakers for our webinars. This is just a sampling of some of the topics that we've covered over the past couple of years. And we've also collaborated recently with the American Society of Gene and Cell Therapy on a 5-part webinar series on gene therapy. A full list of recorded webinars is available on NORD's website and YouTube channel. Next slide. For continuing medical education, we partner with Platform Q Health to develop accredited online education programs on rare diseases for clinicians and online education sessions for patients and caregivers. The goal of NORD's CME program is to decrease the time to diagnosis and improve quality of care. We work closely with our member organizations to develop these programs and assemble panels of speakers that include rare disease medical experts, as well as rare disease patients, to share their personal experiences of living with a rare diagnosis. Many of the CME sessions focus on specific rare diseases, and we've also conducted programs on broad topics of interest to healthcare providers, including a series on gene-based treatment in partnership with the American Society of Gene and Cell Therapy. An on-demand video library of our CME programs is available on the NORD website. In addition to our CME programs, we also reach healthcare professionals with a quarterly e-newsletter to keep them abreast of educational programs available through NORD and our partners. Next slide. The Living Rare, Living Stronger Patient and Family Forum is NORD's annual meeting for patients and caregivers. The education team takes the lead in developing the program and identifying speakers for this forum, with the goal of providing a day of learning, networking, and discussion about a wide variety of topics. In 2020 and 2021, this event was conducted virtually, but we're very excited to be back in person for this forum in Cleveland at the end of June. We'll be talking about topics such as coping with the diagnostic odyssey, building a care team, transition from pediatric to adult care, and other timely topics. The Rare Impact Awards ceremony will be held in conjunction with this forum at the Rock and Roll Hall of Fame to honor individuals, organizations, and industry leaders who've done exceptional work benefiting the rare disease community in the past year. Next slide. NORD's Rare Diseases and Orphan Products Breakthrough Summit convenes every year in October in Washington, D.C. All NORD departments are involved in developing the program and identifying speakers for this meeting, and the education team leads this process. We bring all stakeholders in the rare community together, including leaders from FDA, NIH, patient organizations, industry, payers, and research institutions. The NORD Summit was also held virtually for the past 2 years, but our plan is for an in-person event this fall. We're working on the agenda for the 2022 summit now, and some of the topics we've covered in recent years include best practices for successful partnerships, designing clinical trials for diversity, equity, and inclusion, state and federal perspectives on drug pricing, and the impact of COVID-19 on rare disease research. Next slide. NORD's Students for Rare program provides mentoring for the next generation of medical professionals, researchers, and advocates in order to increase awareness of rare diseases and the challenges experienced by patients and caregivers. Students for Rare chapters and clubs organize campus events for Rare Disease Day and also take part in state-based events with NORD's Rare Action Network. We currently have 32 Students for Rare chapters at universities, including 13 at medical and pharmacy schools, as well as 11 high school clubs. We send out a quarterly e-newsletter to the students that includes a recap of recent events and information about upcoming events and internship opportunities with our member organizations. We're also working to establish a virtual meeting and information exchange network for student chapters and planning to follow the career trajectory of our alumni. Next slide. Thanks again so much for joining today to learn about NORD's educational initiatives, and please feel free to reach out to any of the members of our team at education@rarediseases.org. We're happy to address any questions that you have.
Thank you, Marcia. That was wonderful. And next, I'd like to introduce Dr. Eliza Fink. Hello, Eliza.
Hello, good afternoon, everyone. I'm Eliza, and I'm excited to be here this afternoon to talk to you guys a little bit about NORD's research program. And so just to sort of conceptually take a step back, when we think about doing research at NORD, what we're really thinking about is how can we as an organization support the 350 member organizations and the rare disease community as a whole in advancing everyone towards knowledge, evidence, treatments, and ultimately cures. And so that's really the framework on which we think about all of this, all of the work that we do. And I wanted to spend a few minutes today sort of talking about three sort of buckets of the work that we do: the research that we fund, research that we support, and then the research that we conduct. So moving to the next slide, wanted to talk a little bit about the grant program that we administer as a service for individuals and for patient advocacy groups. And it's referred to as the Jane Holzer Seed Grant Program. It's been in existence for over 30 years, and over that time has administered over $9 million, 200 grants awarded. And really the goal here is twofold. It's really to build a global community of researchers who are excited and can see careers in the rare disease space. And we've heard some wonderful feedback from folks about how this initial funding helped them, show feasibility, get some additional funding, or the publications really help spur other additional research and really help them kind of build a research career. And so this program is something that we have worked with both individuals who choose to individually fundraise or patient advocacy groups where we help them administer these grants. And then moving to the next slide, I wanted to share with you that we are actually in the process of we put out a request for grant reviewers to help us with this process. And we're actually looking for both scientific and clinical reviewers, and for reviewers who are individuals with a rare disease, or family member, or a caregiver for someone with a rare disease. And you'll see on the bottom is the link to apply, but we'll also include in the chat so that you guys can have it. And again, what we're sort of thinking about with this is we want our grants to have both perspectives. We want the scientific and clinical reviewers to consider the scientific merit of the proposal, to think about the validity of the proposed methods and whether they can accomplish their objectives, to think about mentorship and the budget. And we want individuals with a rare disease to think about, does this research feel like it would be impactful for them? If the researcher isn't talking about involving patients in the research, is what they're asking reasonable? Does it make sense? Can somebody be a participant? Will they be able to recruit patients? And so bringing both of these perspectives into our review, the hope is that we'll really get stronger and better reviews and therefore better research. And so there's the link. It's a pretty simple application, really just a little bit about who you are to help us create this pool of people who can review these proposals. So moving to the next slide. So the next program that I wanted to share with you is really about in this realm of research that we support. And one of our primary tools for doing this is our I Am Rare registry platform. And this is a tool that NORD has developed that allows patient advocacy groups to really create registries and natural history studies. The patient advocacy groups are the sponsors of this work, and they are the owners of the data. And the data is entered by individuals with a disease, and it is self-reported. It is done through a web or computer, so individuals can participate wherever they are, whenever they are. And what this really allows is individuals and groups to really think about what are the questions, what are the true gaps in knowledge, what are the questions that are important to us, and try to build through individuals entering this data, really try and start to build this evidence to try and so that they know, because why are natural histories so important? It helps to understand what the disease looks like, because in some of these cases, some of these diseases are so rare, we don't know yet. We don't know what the disease looks like, and therefore, how do we start to think about whether a treatment is helping or not? And so this initial information that patients and patient advocacy groups can bring to the system, can enter in the system, and this is data that becomes available to use to generate that evidence and to learn from. So next slide. So just a couple stats about the program. This program has been in existence since 2014. There are currently about 40 plus registries either that have been launched or that currently in development. There's over almost 14,000 individuals who have entered their data into the platform. And as you can see, numerous surveys and the way the platform is developed, there's each registry will have multiple surveys, perhaps something about demographics, something about quality of life, something about symptoms. And so you see that there's over time, there's been a huge increase in the amount of data that's been entered in this platform. So, and then moving to the last bucket where we're talking about research that we are actively engaged in. And one of the projects that I wanted to share with you is a program that is funded by the FDA, and it's referred to as the Rare Disease Cures Accelerator Data and Analytics Platform. Long name, but cool program. And so really what it's endeavoring to do is really to think about the fact that as a rare community, we need to come together. And instead of having investigators working on small studies, at their university, within industry, the goal of this platform is really to bring all this data together to a centralized location, and then to make it, safely acknowledging privacy, but to bring it together in a way that it can come together and researchers can access it, and new learnings and new evidence can be generated. And so really it's in this realm of really thinking about creating cultures of data sharing and working together and thinking about how do we standardize our data so that we can pull data together. How do we, opening up this data to researchers across the globe, and then hopefully ultimately having a better understanding of a rare disease, its progression, and learning as much as we can from the data that we have. And so the next slide. And so just to sort of think about it, the goal of this program is really to serve everyone. Individuals with diseases, providers, researchers, pharmaceutical companies, scientists, regulatory, all of us really coming together to work towards that common goal. And the hope is that we bring this together, we assemble all this data, we make it as high quality and standardized as possible, and it really can facilitate rare disease drug development. And really success is cures. That's the ultimate goal here, is to really have this data, have high quality data that leads to impactful research and cures. And so with that, I'm going to actually thank you all for your time, and I'm going to turn it over to Corinne.
Thank you, Dr. Fink. Hello, Corinne. How are you?
I'm pretty wonderful. I hope everyone else is having a great day. I'm going to just adjust. So thank you, Lisa. Thank you, Loretta, and good afternoon, everyone. As you've already heard, I am Corinne Alberts. I am NORD's Associate Director of Policy, and I'm going to be picking up the virtual baton for the very last portion of this presentation to talk about public policy and patient advocacy. So with that, we can go on to the next slide. This information has already been touched on a bit by my fantastic colleagues, but just as a reminder, when we talk about rare diseases, we are talking about a disease or condition that affects less than 200,000 people in the United States. And it is estimated that there are more than 7,000 different rare diseases affecting 1 in 10 people. Now, despite this large variety of conditions, there are several common obstacles that the rare disease community faces, including the fact that 90% of rare diseases lack an FDA-approved treatment for that condition. This is where patient advocacy at the state and federal level, both within the administration and with elected officials, can come into play. The goal of NORD's policy department is to drive sound policymaking that addresses these obstacles and ultimately improves the lives of the 25 to 30 million Americans who have a rare disease. Next slide, please. Now, NORD has deep roots in patient advocacy. To go back in history for just a moment, scientific developments throughout the 20th century was leading to many dramatic therapeutic advances in medicine. But around the late 70s, it became more and more clear that people with rare disorders were being left out of this rapid progress. A key reason for this is the small size of patient populations for rare conditions, which acted as a barrier for commercial investment into research and development. So to really break that down, it just wasn't financially attractive for companies to invest in finding new treatments for conditions that only had a few dozen to maybe a few thousand patients. In response to this tremendous unmet need, patients and advocates affected by rare diseases came together to form a coalition that was instrumental in passing the Orphan Drug Act, which creates financial incentives for developing new treatments for rare conditions. As you can see on the slide, this coalition became the National Organization for Rare Disorders, or NORD. Since the ODA passed in the early 80s, it has completely changed the face of therapeutics for rare disorders. Prior to the ODA, there were less than 30 available drugs for rare diseases, whereas today there are more than 650 drugs approved for over 1,000 rare conditions. Now, this is significant progress, but there's still a lot to be done. Like I said, 90% of rare diseases still don't have any treatment. And this is where NORD's continued advocacy comes in. Next slide, please. Preserving and strengthening the Orphan Drug Act continues to be a major focus of NORD, but it is not our only focus when it comes to policy and advocacy. We are committed to finding public policy solutions to the myriad of challenges that patients with rare disorders are facing, however we can, and whether we are working with governors at the state level or with senators up on Capitol Hill. We can go on to the next slide, please. So now that I've given you all of that background and sort of gone over our mission statement, I can introduce you to our policy team. We are a small but mighty crew. This slide also shows how we split the nation into the Eastern and Western regions. My colleague Anissa runs point on policy issues in the East, and my colleague Elise handles policy issues in the West. If I had all the time in the world, I'd tell you lots of fun facts about the team, but we don't. So I'm going to keep moving and talk more about the issues that we work on the next slide. So I told you already that the Orphan Drug Act wasn't our only policy focus, and I meant it. These are the team's major policy priorities for 2022. And if it looks like a big list, it is because it is a big list, and it could also change. As we saw with the COVID-19 pandemic, sometimes things come up and that really impact the rare disease community that require immediate action. We are committed to being nimble and responsive from what we are hearing from our patients and advocates and caregivers. That said, this list does contain the issues that we have proactively identified as being significant needs for large portions of our community. Rather than painstakingly going through every single policy issue that we work on, I wanted to spend the last half of my presentation going through 4 examples that I pulled out that I hope will demonstrate to you the breadth of work that is going on at NORD in this space. Can we go to the next slide, please? Great. So my first example is telehealth. Prior to COVID-19, NORD did a survey of people with rare diseases and found that that 40% of patients were traveling more than 60 miles or more for their medical appointments. This, I think, as Jill already said, is a common issue in the rare disease community, as many patients have to travel quite often across state lines in order to see the 1 or 2 specialists in the nation who is knowledgeable about their rare condition. This then leads to a whole host of other problems. For one, that kind of travel takes time and resources that many people don't have, and it can also create issues with insurance coverage when you're crossing state lines like that. All of this together can compound the financial challenges that patients are already quite often facing. Utilization of telehealth dramatically expanded when the pandemic started, and we have heard from a lot of patients in the years since then that they want to continue to have telehealth be an option for them in the years to come. Recognizing the importance of this to our community, NORD drafted principles in 2020 to guide our engagement on the numerous changes that are being considered by lawmakers about how to take the emergency telehealth provisions that were put into place and make something a bit more permanent. In the short term, we are urging states to join the Interstate Medical Licensure Compact, which helps to streamline the licensing process for physicians looking to practice in multiple states via telehealth. But we also think that in the long term, lawmakers should be making data-driven decisions in order to fully and effectively integrate telehealth seamlessly into the healthcare system so that it can be an option for rare disease patients when it is appropriate for them. Next slide, please. Another significant focus of NORD is ensuring that patients have access to quality, comprehensive, and affordable health coverage. This is a broad but really important category of our work. To run through some of the sub-issues within this space, we believe that the 12 states that have yet to adopt Medicaid expansion should do so as soon as possible. And we're also opposing efforts to put harmful restrictions on Medicaid access into place, like work requirements or proposals that would restrict access to drugs on the Medicaid formulary. We are also opposing the spread of something called junk insurance, which are short-term insurance plans that are not part of the Affordable Care Act, but masquerade as real coverage. These plans are spreading in many states, and they can medically underwrite, turn you down, they can charge you more based on your health status, or exclude coverage of pre-existing conditions, all of which is unacceptable to us and to patient advocates. Last but not least, we want to make sure that health insurance is actually affordable. So to that end, we are supportive of extending the enhanced advanced premium tax credit subsidies that were made available as part of the American Rescue Plan. These subsidies lower the premiums for many people who purchase insurance through healthcare.gov or their state marketplace if you live in, say, California or Idaho. These subsidies have helped millions of Americans to get comprehensive health insurance at affordable price, many for the very first time. And that's why NORD is urging Congress to not let these subsidies lapse and to extend them for years to come. Next slide, please. My third example is another totally different priority of NORD, which is the reauthorization of the user fee acts. This is a very timely big deal right now. The UFAs, as we sometimes call them, is legislation that is critical to the development of new treatments for rare diseases. What the UFAs do is they authorize FDA to collect fees from drug companies to fund the review and approval of new drug applications. So this is key to getting new drugs onto the market. The UFAs must be reauthorized by Congress every 5 years, and 2022 is a reauthorization year. So right now there is a significant amount of work going on in Congress and at the FDA to make this happen. In addition to the collection of fees, this legislation is an opportunity to make other necessary policy changes that are related to the FDA, such as improving diversity within clinical trials or improving the use of real-world evidence in drug development, among many other things. NORD is highly involved in this process and will be until the UFAs are signed into law, which will hopefully be sooner rather than later as they do expire at the end of September. Next slide, please. So the very last example policy area that I wanted to highlight for you all today is at the state level, and this is Project RDAC. As you may have realized already from my presentation and from my colleagues' presentations, rare diseases are complicated and patients face many unique challenges every day. But due to the variety of rare diseases and the small patient populations, again, we have found quite often that lawmakers do not have an in-depth understanding of the rare disease community's needs. This lack of awareness can contribute even more to the obstacles that are faced by patients and their loved ones. To address that need and provide patients with a stronger voice within state government, NORD is working to create rare disease advisory councils, hopefully in every single state. RDACs provide a forum for local patients, caregivers, and experts to analyze the needs of the community and make recommendations on how to improve public policy directly to lawmakers. The RDAC members can include a variety of stakeholders. I've already mentioned patients and caregivers, but they could also include healthcare providers, health insurers, representatives from biotech industry, researchers, and patient advocacy organizations. RDACs have already been enacted in 23 states, and by the end of this week, it may be 24 states, as the Colorado State Legislature just sent authorizing legislation to the governor's desk for signature. So this is something that we have really been able to rally the community around and have a lot of progress on just this year alone, and something we're quite excited about. Next slide, please. All right, I have covered a lot of ground in this presentation, but if you want to learn more or see how your state is measuring up against your neighbors in terms of the issues that I have gone over in this presentation, I encourage you to go to our website, rarediseases.org, and check out our state report card. Every year, NORD makes a state report card where we look at all 50 states and evaluate them on how effectively they are serving patients with rare disorders. We grade on 9 different categories, and that resource is just put in into the chat and is a really, really interesting read. And we have interactive maps where you can look at your whole region and see how you're measuring up. Next slide, please. The very last but very important thing that I wanted to mention is that I encourage everyone here to sign up for our Rare Action Network email list. This is how you can be notified of things like RDAC legislation in your state or important policy that is happening at the federal level. So if you're interested in getting involved in our policy work or becoming an advocate yourself, this is really the best way that you can do so. If we go to our very next slide, that concludes my presentation. Thank you again for your time, and I look forward to answering questions from the audience. With that, I will turn it back over to our hosts.
Thank you, Corinne. That was wonderful, and congratulations on the successes that you've had. It's so exciting to hear about you, and we're so honored to be able to host this webinar. So with that, I will turn this over to a question and answer period. So Leslie Boone is on this call, and she is a key member of the ResearchMatch team here at Vanderbilt University Medical Center. Hi, Leslie.
Hi, Loretta, and thank you all for joining. This has been quite an informative webinar. So I do have some questions, and we're certainly receiving more from our listening audience. And so I'll start with just a few in the time that we have. So Jill, I want to go back to your presentation and ask a few questions. Does NORD have resources for newly diagnosed patients? And also, when you receive queries, do you also receive queries for undiagnosed patients?
Thanks, Leslie. I appreciate that. It's an important question. So yes, we do have resources for the newly diagnosed patient, but every patient, every individual is a little bit different. So again, we encourage you to call the Information and Resource Services team at NORD, and we can not only provide you with some resources for being a newly diagnosed rare individual, but help to answer questions that are specific to you. And tell me again the second part of that question. Forgive me, I was very focused.
Do you receive queries from undiagnosed patients?
Thank you. Yes, we do receive queries from undiagnosed patients and help those individuals in their quest to receive a diagnosis. We do some work with the NIH, UDN, the Undiagnosed Diseases Network, and while we can't influence the patients that they take, we do support them in their efforts, and we provide financial support to individuals who are enrolled in the Undiagnosed Diseases Network. So we're able to work collaboratively with them as well.
On your website, oh, go ahead.
I was going to say, and one other thing is we have our new Centers of Excellence initiative, and that's another great resource for individuals who are in the process of getting diagnosed. And again, while we don't refer to the COE and we don't make those appointments, those are great resources, and we can help you to identify who the appropriate contact person is at the centers of excellence, so that's a good starting point.
Oh, that's wonderful to know. On your website, and this is just something I'm thinking about as you were answering that question, when you mentioned the undiagnosed disease network, is that on your website as well? If people are thinking about a constellation of symptoms and they want to be a part of that network as well, how would they find out more about that?
Sure. So that is a separate entity that is part of NIH, the UDN, or Undiagnosed Diseases Network. We do reference it in our patient assistance programs, and we do provide contact information for the UDN, but the UDN is really a standalone entity. So we can help to get you connected to individuals over there or how to initiate the process. But from there, we are separate.
All right, thank you. Corinne, as you were describing the rare disease advisory council, it sounded very like a really good role for those who are looking to get involved in advocating for their condition. Could you tell us a little bit more about how a participant could become involved in that council?
Absolutely. So if you are interested in getting involved in Project RDAC, you can go to our website, rarediseases.org, where there will be a little Project RDAC webpage where we have information about what states already have an RDAC, resources for already enacted RDACs if you're already involved but want to learn a bit about best practices, or if you aren't involved and you want to, there will be an email address on that page where you can reach out and contact us, and we'll get back to you about how to get involved in the coalition, maybe if you want to help pass an RDAC in your state. If otherwise, another option is you can just email us at policy@rarediseases.org with your question, and we will get you where you need to be.
Thank you. So as we're thinking about, these rare disease advisory councils, Marcia, in your presentation, you talked to us about this registry, and can you describe what's the role of medical experts in creating NORDs? I guess maybe it wasn't Marcia, maybe it was Elisa talking to us about the registry, but what is the role of medical experts in creating NORDs educational resources? So that may go to Marcia or Elisa. I'm not real certain who would be the best person to answer that question.
Sure, I can start out with that. The rare disease reports and the videos are reviewed by appropriate medical experts in order to vet the content. Sometimes physicians and researchers will reach out to us and ask them, and they will ask us how they could participate in developing a new report for NORD on a topic that we don't currently have a report on. And we're very open to working with these experts. We have writers' guidelines that can be provided. We have sample reports that can be also included in the instructions as to how to develop a new report. And it's important for the content to be directed toward patients and families. Many medical professionals are not often well experienced in writing for that general audience. So we can help in that process if need be in simplifying the language to make sure that the report is easy to understand for somebody who doesn't have a medical background. We're very, very grateful to our medical experts who, for the most part, are volunteering their time to help us assure that the information we provide is accurate and complete.
So how is that information generated? I guess the medical experts, of course, would know what needs to go into the report, but is it informed in any way by the patient population?
Oftentimes, the medical experts are serving on a medical advisory committee for a disease-specific patient organization, and that's how they come to us. So because of that experience, they're usually very well tied in to what the patient experience is, and also how to, many times they learn from that experience how best to communicate the complicated medical and scientific information in writing.
Thank you. And also, as I'm thinking, Aliza, this question may be for you. Can a newly established patient organization work with NORD to establish some basic resources to support research?
Sure. Happy to sort of talk about that. And actually, I think sort of what I would sort of recommend as kind of a first step is NORD has actually put together some great resources on a learning management system, and we can put the link for that in the chat, which really sort of helps groups think about what we refer to as being research ready. Because research, it sort of has its own language. It sort of has a lot of steps that are sort of very unique to research. And so this is sort of an opportunity for groups to get an understanding of what's the scope of research, what are some of the things involved in conducting research, what are the types of research, what is necessary for different types, to help them think about as an organization, what's the best first step for them? There's multiple paths they could choose. What makes sense for them? Is it something like a registry where they start to think, even just a contact registry to find out like who has this disease? Who are our people? Is it time to think about, we need to really understand what this disease looks like long term. We need to collect some longitudinal data. Or maybe it's thinking about building relationships with the wider academic community to try and build research that way. So that learning management resource is really an excellent tool to really get some of that knowledge to start thinking about it.
Thank you. That's really helpful. We have a few more questions that I'm going to ask, and anyone can jump in and answer them. So we had a question from our listening audience about advocating. And the question is, does NORD help by advocating I guess they meant, advocating employees with their employers to obtain accommodations. So this is really about, I think, those folks who have a rare disorder and wanting some guidance on how NORD may help facilitate advocating for accommodating their specific condition.
I'll jump in. So our Information and Resource Services team is able to help you to ask the right questions, frame your proposal, if you will, in a certain way. And so we can help to sort of guide that process. We can't fight the battle for each individual, but we can help to provide some guidance and some resources that have been successful, and to point you in a direction should you need assistance beyond what we can provide.
I think that's helpful and necessary. Let's see. We also had a question about, again, about assistance. Jill, could you tell us again what sort of assistance there is for travel, or how you go about receiving that assistance for those who have a rare disorder?
Sure. I put a link in the chat to the website, which has NORD's assistance programs listed on it. If you don't have internet access, you can certainly give us a call and we can walk and talk you through the process. Unfortunately, there are 7,000 rare diseases, and I do not have financial assistance programs for all rare diseases. We do try. Sometimes the financial assistance may be only for premium or copay assistance, and somebody might need travel and lodging assistance. If we don't have the resource, we're going to help you to locate that resource, and we can help to point you in the right direction of the resource. Unfortunately, so many things, like so many things in life, it is dependent on money, funds, and we are dependent on donors. So we really strive to utilize the funding that we receive and the donations that we receive to assist the greatest breadth of the community possible. again, where we don't have the resource, we're going to help you to locate resources and identify resources. And the other thing to think about is sometimes you can be kind of fixated. I need help with X. I need help with X. Well, if we can help you to afford Y, maybe you can afford X. And so sometimes it's helping to sort of reframe the question so that we can get you some help and we can get you on the path that's going to allow you to take a step forward.
That's helpful. So this question came from someone in our audience about opportunities for students, and I believe we touched on that a bit. They wanted to know, are there funding opportunities for graduate students who would like to incorporate rare diseases into their current theses or dissertation projects? Is there an opportunity to do so?
I'll comment on that briefly. We don't currently have funding. We certainly have opportunities to work with students on topics that they are interested in that align with rare disease. But we don't currently have a way to financially support that effort.
Thank you, Marcia. We have a few more questions. I will say to the audience, we're not going to address any specific health conditions. I know that you're anxious to learn about your specific condition. We're not addressing those questions at this time, but I would ask that you reach out through the NORD website to look for more information that may be available on your condition listed there. Thinking about, just back to the research portion, Eliza, that you mentioned joining this registry. Could you clarify what you mean by registry? Is this an outcomes registry? And what is it that participants could gain from participating in a registry with NORD?
Sure. So to answer the first piece of it, it's really up to the patient advocacy group to design the registry that's meaningful to them. So it really can be what you want it to be. And some groups have really thought of it more as sort of like a contact registry, really just some basic information about individuals with the disease. And other groups really have collected longitudinal data over time of key outcomes. So it's customizable, and it really has the opportunity to be what is meaningful to that patient advocacy group. In terms of why, I think there's a few things. I think in this rare world, we need everyone's story to help us understand the bigger picture. And so everybody who's willing to sort of give us their experience, because nobody knows this disease like the individuals living with it, and nobody can really give us the full breadth of that disease. And being able to collect that information from people really teaches us things about these diseases we did not know, and that clinicians don't really have necessarily. They see individuals at various times, but so much happens in between those visits, and the richness of that data really helps us understand better the disease. And then one of the features of the platform that it does allow is, once an individual has entered data, it actually shows them sort of the aggregate data of everybody else who entered data on that particular question, just to give you a sense of like, how do I compare to other people? What does it look like for other people living with this disease? And just to sort of give you a little bit of an insight into other individuals living globally with this disease.
And so when they sign up, is that, I don't want to say automatic, but does that information come to them through like email, or how do they see it?
It's a dashboard right on the platform.
Okay. Gotcha. All right, well, we have 1 minute left. I'm going to turn this back over to Loretta, but I certainly appreciate all the questions that have come to us in the chat. If there are questions that we can answer at a later time, we will, but I just want to thank you all for joining us, and certainly thank you to our panelists.
Yes, thank you very much for joining us. And it's wonderful that you all joined us as well. This has been recorded. It will be on our YouTube channel. And we will see you the next time we have another webinar. And hopefully you'll find resources that you need on researchmatch.org. Thank you, everybody.